The point of view that plugs you in. The perspective we all need. Danielle Smith on 770 CHQR. Join the conversation. Toll free 1-800-563-7770. Call or text 403-974-8255. Danielle Smith on 770 CHQR.
Brought to you by the Popowich Carmeli Advisory Group, CIBC Wood Gundy.
Well, greetings, friends. We have got a lot to get to today. I know you want to ask questions of Ken King, and you will have a chance to do that at 10 o'clock today. So I'm sitting in my chair, I'm watching my texts, I'm going to just stack them up, and you tell me what questions you want answered. 403-974-8255. That's number one. Number two, we're not going to talk about it today, but I think this was a crucially important decision that the government made to not go down the path of a capacity market in electricity. As you know, I did countless segments trying to understand what that was all about. And here's my take on it. Because a political decision was made to move towards a greater share of renewable energy that is intermittent and unreliable, i.e. wind and solar, the only way it could possibly work was that if you had natural gas peaking plants able to come on at a moment's notice when the wind is not blowing and the sun is not shining. And everybody was going to pay for that. And so it was going to increase our bills across the board. And so I think they've made a really good decision here. It's one of those things where if they'd made the wrong decision and we saw the same kind of price spikes that they did in Ontario, then we'd all be talking about it. You might not hear enough about this because I think they actually made the right decision on this one. Now, the only thing that is concerning me is, are we going to be over-invested in natural gas? Because our coal plants are going to natural gas. We don't have hydro of any significant amount. We are not going nuclear in any significant way. And we're going to be trying to open up our natural gas pricing to the international market through exporting LNG, which will cause the price to spike. So I think we need to have some additional diversity in our electricity market. I don't love wind. I'm kind of partially in love with solar. But I think I might love geothermal, and you might too, after our segment today at 10:30. So we got lots to talk about today, but I wanted to start off because last time we spoke with the Minister of Health, he had made a decision that he was going to cancel the superlab proposal. That was the monstrous $595 million project to centralize all medical lab testing into one huge facility. Now, that does mean that the company that has been operating it to this point, Dynalab, they've been doing private lab tests for, I think, 50 years. When I spoke with the minister last time, he said, we have to go through a new RFP process, and I thought I'd wait to get an update on him. However, here's the new development. The Canadian Society for Medical Laboratory Sciences said that making the decision to pull the plug on the superlab in Edmonton will expand existing gaps in healthcare access across Alberta, and they're opposed to it. So the minister got into a bit of a Twitter exchange yesterday about it, questioning some of the motives behind it, wondering whether or not it, and there's probably some reason to wonder whether or not that this is politically motivated. And we're going to talk to him about that, along with a variety of other things. One more thing I should say is that they have awarded Ernst & Young a $2 million contract to review Alberta Health Services. Now, he says that it's not going to be all about delivering services through the private sector. So we will find out what it is about. But I am quite interested to know how it is the Saskatchewan model for service delivery is going to begin to be implemented here. So tons to talk about with Tyler Shandro, Minister of Health, who joins me now. Minister, thanks so much for being with me again.
Thanks for having me.
So let's first talk about the decision on the lab. I don't know if you're any further towards deciding what the next step is going to be. If you're just going to grandfather in Dynalab, they've been doing it for 50 years, keep on doing it, or whether or not you're going to go back to the drawing board with an RFP and open it up. Have you made a decision on that yet?
Well, there will be an RFP when their contract is going to be expiring, I think 2021. And so there will be an RFP at that time, and we hope that they make a submission to be one of the proponents in that RFP. And
has one of the errors been in not having enough competition? Like, I'm always skeptical. I'm just as skeptical of a big government monopoly as I am on a single private sector provider. Is there some reason why we might want to look at, if we're not going to go with a single public provider, having more services being provided by different private sector players?
Well, I'd be very happy if there was a way to encourage multiple proponents and to encourage multiple awards for so that there isn't just one successful proponent at the end of the RFP. I'm happy to look into that.
What is the ideological difference here, do you think, between the approach the NDP took in wanting to have a single lab government run versus the approach that you're taking?
The ideological difference? Well, that they didn't want there to be private providers, that they wanted to amalgamate. Some of the lab work was done by AHS throughout the province, and as well in the north. Calgary Lab Services, Lamont and Covenant Health as well, and rolling it all into just one entity, Alberta Public Labs. And so the goal for them was in 2021 to spend $50 million of taxpayer money to be able to nationalize DynaLife at the end of that and have just one provider for the entire thing. So I suppose the ideological difference is that they didn't want there to be any variety, any choice, which actually went against a lot of the advice that they received from the Health Quality Council.
Well, it's funny because it sounds like the Health Sciences or the Laboratory Services Society believes that there's some advantages to having a single government provider. Like, they talk about service gaps, and I'm not sure where the service gaps are coming in. Maybe if I understood kind of the nature of what it is they think a single government lab services would solve, then I'd understand why it is they think that's the solution.
Well, far be it for me to try and explain their advocacy for them. They're welcome to advocate for what they think is the best choice for Albertans, but I think, as I've said previously, if you're going to describe our current lab services in this province as crumbling, I think then it is politically motivated.
Okay. The one of the stories I read, and you can maybe elaborate on this, is that the place where you see the new equipment, the new tests, the new technology is actually in the private sector providers, and where we have deficiencies is in the public hospitals. And so the question I would have, I mean, it seems to me like they would be hoping that by consolidating everything into a single entity, they'd get all of that investment. But you're still then left with a problem of, are we having deficient services in our public hospitals? Is there some reinvestment that needs to happen there? Oh,
there's always a need for reinvestment. And I think part of the need for some of the reinvestment that's coming up now is partly because in 2014, the RFP for the North, as you mentioned, DynaLife has been a provider for a number of years. In 2014, there was an RFP. DynaLife actually at that time was not successful, and it went to an Australian company named Sonic. Sonic was planning on reinvesting a lot in new equipment out of their own pocket. So by the NDP canceling that RFP and not proceeding with DynaLife, or sorry, not DynaLife, with Sonic, that, and as well as delaying for a number of years for them to wait and with this plan, which was really not meant to reinvest in lab services, but meant to nationalize DynaLife, that provided a few more years of gaps. So we do need to reinvest in lab services, and we're looking forward to being able to do that, as we have to reinvest in healthcare infrastructure in general.
Oh, that also then explains why DynaLife might not have done any additional investment and kept things up, because if they were going to see their contract canceled in 2021, then are we seeing some gaps there too?
Well, in 2017, I think the NDP went to them and wanted to nationalize them at that time, realizing they had to renew DynaLife at least for 4 years. And then that's where the 2021 date came up for the NDP to nationalize them in that year. For $50 million. So I can imagine DynaLife probably was on eggshells for those last 2 years, as they didn't know what their future was going to hold. So, but we've made it very clear that's not going to be our plan for DynaLife. We will be proceeding with an RFP, and we hope that they submit.
When do you think that decision is going to be made?
For the new RFP,
Mm-hmm.
I think if their contract ends in 2021, I think we have to start work, I think, this fall on this new RFP, and so I'm looking forward to working with the ministry and having that starting as soon as possible.
What has the experience of patients been like then in the last 4 years in this area? Like, what kind of complaints are you hearing about? Is it the personnel who are taking a long time in hospitals getting their tests back? Is it that there's certain tests that are unavailable? Is it that there's a backlog? I'm trying to understand the nature of what it is they were trying to solve and where we find ourselves at now.
The NDP trying to solve? I don't think there was a problem. I think I don't think there was a problem they were trying to solve. I think they had the ideology of wanting to nationalize DynaLife, and And that was what their goal was. I don't think it had anything to do with trying to resolve any complaints that patients had. I myself haven't heard any complaints about patients. I think those of us in Calgary who for a number of years have been served by Calgary Lab Services have been happy with their hub and spoke model and with the quality of service we've gotten from Calgary Lab Services. And I should note too that there's a difference in the way that lab services are provided in Calgary than in Edmonton in the north.
Talk about that a bit, because I thought Lab Services was independent and then it was taken over by AHS. If I'm wrong on that, you should correct me.
Well, Calgary Lab Services does 100% of the lab work in Calgary. And the difference is that DynaLife, I mean, if we can think of it two different buckets, there's kind of patient care, laboratory work that needs to be done. And then there's kind of the more complex, the really complicated stuff that you don't really make a lot of money off of. And so that wasn't being done by DynaLife. That was done by AHS. They had their own laboratory services in Edmonton and in the north. So that was being done by AHS, that 20, I don't know, maybe 30% of lab work. DynaLife was supplementing by doing, all the patient care stuff that can be done. You take a sample, it goes through one analyzer. They can do it really efficiently and very well. So that's the difference between Calgary Lab Services and DynaLife.
Okay, let's then talk about whether or not this is a vote of non-confidence from the minister in Alberta Health Services. Because does this indicate that you don't think that they'd be able to run the system under their umbrella? Because
No. I think DynaLife, have mentioned before that they would like to do that other work. I mean, if they ever wanted to, I'd be interested in hearing that. Or if they didn't want to, I don't think it's has anything to do with us not having faith in DynaLife and being able to provide those services. It was just the way the contracts were set up in the past in the north. It was just different because of the legacy health authorities. How it was done in Calgary and in the north was just different at the time, and so it was just done by the health authority at that time. DynaLife in their contract, it was a legacy contract.
Okay, but then by canceling the NDP approach and not going to a single model run by Alberta Health Services, is that a vote of non-confidence about Alberta Health Services? No,
not about Alberta Health Services either. So now all that work that was being done by Alberta Health Services has been rolled into with Calgary Lab Services and this new entity called Alberta Public Labs. And so they're now doing 100% of the work in southern Alberta, as well as that 20% that's not patient care. I don't know how to describe it accurately, but that would be done in the north as well.
Okay, let's then talk about your plan for Alberta Health Services. Whenever I do a segment on it, I get really sort of, it's two worlds. Those who've had cancer or heart disease and have gotten into the system quickly and received good care have nothing but great things to say. Anyone waiting for back surgery, knee and hip replacement, something minor, have nothing but negative things to say. How do you assess, just coming into it, the performance of Alberta Health Services? Because you've now hired Ernst & Young to do a review. What are you going to have them look at?
We're going to have them look at the structure. We're going to have them look at, for example, if there's duplication between the ministry and AHS, if there's duplication between AHS and the Ministry of Infrastructure, we're having them look at if there's duplication between what Covenant does, Covenant Health, as well as AHS. Processes, programs that we want to make sure that taxpayers' money is being spent in the most efficient way. And so we can find those savings and reinvest it in the front lines.
How do you get to more local decision making? I mean, you've probably heard the same stories I have. When I was traveling up north, for instance, I remember going to one hospital where they made the decision that they could no longer do their laundry on site, so they had to send it out 3 hours away to get the laundry done, where they couldn't have the authority to call in a local person to change the light bulb. They had to go through their health region to be able to get the light bulbs changed or the grass mowed. These are the kind of decisions that I think make people crazy. There's got to be a lot more local control. And how do you get that within this structure of Alberta Health Services, where it seems like you have to run every decision through 6 layers of management?
Well, we're starting with capital planning and making sure that what we're moving towards is zone planning. And so working within the zone and dealing with capital planning within the zone and hopefully getting to a point, especially because this is definitely feedback I've already heard Ernst & Young get about Alberta Health Services. So excited to see what they would recommend on how decision making can be done more efficiently. That is, decentralized. And so, yeah, I don't want the opportunities for local innovation to be stifled in any way by centralization of decisions. So If I'm looking forward to seeing what Ernst & Young can say about that in particular, and seeing how we can move forward and trying to encourage more efficient decision making.
Okay, now it does say that this isn't about trying to identify services that can be privatized. Fair enough, because even if you do follow the Saskatchewan model, you're still going to have a huge amount of services that are being done by Alberta Health Services. You've got to make sure that they are being done in an efficient way. But can you shed some light on what the approach will be in developing the Saskatchewan model? You spent the Premier spent a lot of time talking about that during the election campaign, allowing private delivery of publicly funded services. When does that get going?
Well, so first of all, when we're talking about privatization, if we look at the laundry services and the goal of the NDP to also nationalize that and have it done totally in-house by through one processing plant, we are proceeding in keeping our vendor to continue in Alberta, in Edmonton and Calgary, as well as looking at other ways for us to encourage other approaches other than just laundry. If you're talking about surgical facilities, that seems to be what you're talking about.
It is, yeah. Okay. Like we used to have HRC, which was doing a tremendous job of providing knee and hip replacements and documented at a much lower rate than the public system. And they ended up, because of a variety of decisions made by bureaucrats, ended up being shut down.
But I reject describing those facilities as being private. I mean, if they are publicly funded, they're non-surgical or non-hospital surgical facilities, and they can be owned and operated by physicians, but they are publicly funded, and so I reject describing them as private. But those definitely are things that we are going to be looking at. There's 80 of them that currently exist in the province. We are interested in working with specialties in understanding what procedures can be done in those non-hospital surgical facilities.
Okay, so let's say Steve Miller, who was the principal orthopedic surgeon, comes to you and says, good, I'm glad that you're going to allow me to set up my own orthopedic shop.
Again, I suppose.
How do I do it?
So there is a process now. I'd like to work with the ministry on being able to streamline that. I think part of the problem, though, too, is if you talk about Dr. Miller, is that Dr. Miller has a past where he did set up a facility, and then he had the rug pulled out from under him. So part of what I'd like to do is being able to work with physicians who currently have one of the 80 facilities in the province, or if they want to start a new one, to give them the stability and the predictability to knowing that, if I'm ever out of this job, the next person who comes along isn't going to yank the rug out from under them. So I would like, if people aren't going to invest that capital in a new facility, that they have that stability, they have that predictability, and they don't ever feel worried about making that investment.
Does that require some legislation? Like, look at the legislation you put forward on royalties. You promised every oil and gas investor that if they invest in the province, the royalty rate is not going to change on them in the time their well is in operation. How do you provide the same certainty with private care providers? Because it's a huge investment they would have to make.
Well, I mean, it's one of the questions we're looking at. I don't know the answer to that yet, whether it's going to require legislative change or whether it's just something we can do through our policies and our processes with these non-hospital surgical facilities to provide that predictability. It may not require legislative change. We do, I think, when it comes to this ministry, need a substantial amount of legislative change. When it comes to Alberta Health Services, I think there's 6 different pieces of legislation that deals with just them and acute care. There's Hospitals Act, there's Emergency Medical Services Act, there's the Alberta Health Act. I think there's a need for us to be able to look at, and I think it's going to come out of the AHS review, how do we take a look and modernize the legislation regarding Alberta Health Services and continuing care. And our surgical facilities in this province.
When are we going to get that review? Because I'm going to make a note to have you back on when it comes out.
December 31st. I'm happy to come on before then, but especially after that as well. I have been asked many times by our friends in the media, when am I going to release that? I didn't commit to December 31st. I'm not trying to play games or anything like that. I think this is a report that is going to have to be disclosed to Albertans. I'm committing to releasing it as quickly as I can after we receive it. And I'm looking forward to coming back on the show to be able to discuss that in particular.
I'm looking forward to that too. Thank you so much for your time today.
Oh, thank you. That
was Minister Tyler Shandro. He's the Minister of Health. A number of initiatives coming forward, and we're going to see some big movement after December 31st. If you got some comments, 403-974-8255. We'll be right back on 770 CHQR.